How do molecular TB tests detect isoniazid resistance? How do molecular tuberculosis tests detect isoniazid resistance? This is an important question, especially as tuberculosis remains a significant global health challenge. Molecular tests are advanced tools that help identify specific genetic mutations in the Mycobacterium tuberculosis genome, which can lead to resistance against isoniazid, a key antibiotic used in treating this disease. These tests primarily focus on two critical areas of the bacteria's genetic material, the katG gene and the FAB-G1 NHA promoter region. The katG gene is responsible for producing an enzyme that activates isoniazid. When mutations occur in this gene, particularly at the katG315 codon, the enzyme is altered, preventing the drug from being activated. As a result, the bacteria can survive despite the presence of isoniazid. The FAB-G1 INHA promoter region plays a different role. Mutations here can lead to an overproduction of the INHA enzyme, which is the target of isoniazid. When this enzyme is overexpressed, the effectiveness of isoniazid is reduced, contributing to resistance. Molecular tests utilize nucleic acid amplification techniques to analyze bacterial DNA extracted from patient samples. They employ specific probes or primers that bind to the target genetic regions. For instance, some tests use dye-labeled probes that can distinguish between normal and mutated sequences in the katG and INHA genes. If a mutation is present, the probe will not bind as expected, or it will produce a different signal indicating resistance. There are several common molecular methods used for this purpose. Line probe assays detect mutations by hybridizing amplified DNA to probes fixed on strips. Real-time polymerase chain reaction assays use fluorescent probes to identify specific mutations during the amplification process. Another method, melting curve analysis, identifies mutations by comparing the melting temperatures of wild-type and mutant DNA sequences. One of the significant advantages of these molecular tests is their speed. They can provide results within hours to days, which is much faster than traditional culture-based drug susceptibility testing that can take weeks. However, it is essential to note that while these tests are effective at detecting the most common mutations associated with resistance, they may not identify rare or low-frequency resistant strains. In summary, molecular tuberculosis tests detect isoniazid resistance by identifying mutations in the katG gene and the FAB-G1 INHA promoter region. By using nucleic acid amplification and specific probes, these tests enable quicker diagnosis of resistant tuberculosis strains, allowing for timely and effective treatment decisions. If you have concerns about tuberculosis or its treatment, it is always best to consult a healthcare professional for personalized advice.